Right, we're going to take you to Calgary now, where we're going to hear an outbreak, E. coli outbreak update from officials there. Let's listen in.
And words of reassurance to their understandably distressed and anxious parents. And it also includes an intricate and comprehensive investigation into the outbreak source, proactive closures of daycare facilities where appropriate, and the meticulous investigating that has helped us to limit transmission of this E. coli bacteria. This has been a challenging and very difficult time. And as I said last week, we're still not out of the woods. However, we are encouraged by falling daily case numbers and a sustained decrease in children who require hospital care. We're also not seeing any significant spike in secondary cases. This is a cause for cautious optimism as we move to what we hope will soon be the end of this extremely serious outbreak. That said, our thoughts remain with those children who have not yet recovered enough to go home, with those parents who sit bedside looking for signs that their child is on the mend, and with anyone who is impacted by daycare closures. Today's numbers continue to trend in the right direction, but we must remember that these are not just numbers. These are Albertans, most of them under the age of 5. As of September the 19th, there have been a total of 348 lab-confirmed cases connected with this outbreak. This is unchanged from yesterday. There have been a total of 27 secondary cases. Encouraging news, as there have been no additional secondary cases confirmed in the last 48 hours. It should be noted that some secondary transmission is common, and in fact, it's expected as part of a large outbreak such as this. Our aim, though, is to limit that transmission as much as possible. There are currently 8 children receiving care in hospital, 1 less than yesterday. All of these children have been confirmed as having hemolytic uremic syndrome, including 2 that remain on dialysis, 1 less than yesterday. Those children with more severe illness are in stable condition and they are responding to treatment. Our frontline healthcare teams continue to provide them with the very best of care and support possible. A total of 707 children connected to this outbreak have been cleared to return to a daycare facility. There are currently 6 daycare facilities under closure or partial closure since September the 15th, as instructed by AHS Environmental Public Health. Closure orders were rescinded for classrooms 3 and 4 at Vic Academy in Calgary the afternoon of Monday, September 18th, following negative test results for E. coli. I acknowledge that the closure of a daycare creates incredible stress for parents. Suddenly, they're faced with either taking time off work or finding alternative arrangements for their kids. This is not easy, and the temporary closure of a daycare is not taken lightly. I cannot stress enough how important it is for people to follow instructions from public health about what they should do before their child can safely return to daycare. It is crucial for parents with children that attend daycares to follow this guidance and the guidance that's provided to them by healthcare professionals. If your daycare is closed, please respect why this is done and keep your children at home. Only send your child to another facility if they've tested negative for E. coli, if they have no symptoms, and if they've been given clearance from AHS. To all daycare operators in the Calgary region, please confirm the health and the daycare history of children who are new to your facility. This will protect you, your staff, and most importantly, the kids in your care. It is vitally important that these requirements are adhered to limit transmission and to prevent more people from falling ill. By working together and by following health guidance, we will stop this outbreak. The public health investigation into this outbreak continues, and we are hopeful that we are getting closer to understanding how this outbreak occurred. Our public health team is reviewing the food histories for more than 1,150 children and 250 daycare staff. This includes both those who became ill as well as those who did not, all of whom were at the 11 affected daycare sites between August 15th and 31st. By comparing the complete food history from both groups, and then combining that with what is known about how food items were prepared and distributed, the team can potentially identify commonalities and ultimately identify the likely source of this outbreak. We anticipate having an update on this work very soon. I would again like to express my heartfelt thoughts to anyone impacted by this situation. And I want to reassure Albertans that your public health teams are doing all that they can do to get to the bottom of what happened here. My hope is that we will continue to see children recover and that their lives will soon return to normal. Thank you.